A Cancer Drug and Chemotherapy Guide. Chapter 1. A Cancer Drug Guide. Cancer Drugs Info. Some cancer drugs are as follows. Try looking for them at phrma.org or typing the terms into search engines to get more information. 5-fluorouracil/5-fu. Capecitabine/Zelita. Cyclophosphamide/cytozan. Docetaxel/taxotere. Doxorubicin/adriamycin, Rubex. Epirubicin/Elance. Etoposide/Vepacid. Methotrexate. Mitoxantrone/Noventrone. Mitomycin C/Mutamycin. Paclitaxel/Taxol. Trastuzumab/Herceptin. Vinblastine/Felbin. Vinorelbine/Navalbine. The anti-abortion drug RU486 can shrink brain, breast, and ovarian tumors. Herceptin is the current wonder drug. Read about it in the New England Journal of Medicine. There's a drug out called Rituxan for non-Hodgkin's lymphoma cancer. A list of specific cancer drugs. Find info about drugs at ncbi.nlm.nih.gov/pubmed. Cancerindex.org. Yervoy. Optivo. /Keytruda. Abraxane. Amsacrin. Amygdalin/Laetrile registered. Aspirin. Azacitidine. Bonarji protocol. Beljanski remedies. Bendamustine. Bleomycin. Busulfan. Cabazitaxel. Capecitabine. Carboplatin. Carmustine. Chlorambucil. Cimetidine, Tagamet registered. Cisplatin. Cladribine. Clofarabine. Chrysantispis. Chromalin. C-statin registered. Cyclophosphamide. Cytarabine. Dacarbazine. Dactinomycin. Daunorubicin. Dichloroacetate, DCA. Docetaxel. Doxorubicin. Epirubicin. Escajol. Etoposide. Everolimus, Afinitor. Fludarabine. Fluorouracil. Gemcitabine. Gliadal implants. Hydroxycarbamide. Idarubicin. Ifosfamide. Indomethacin, Indocin registered. Interleukin-2, IL-2. Ipilimumab, Yervoy. Irinotecan. Leucovorin. Liposomal daunorubicin. Liposomal doxorubicin. Lomustine. Low-dose naltrexone. Melatonin. Melphalan. Mercaptopurine. Mesna. Metformin. Metformin and the overall risk of cancer. Methotrexate. Mitomycin. Mitotane. Mitoxantrone. Netoplatin. Negative studies on melatonin. Nilotinib, Tasigna. Obinutuzumab, Gazyva. Oxaliplatin. Paclitaxel. Pamidronate, Aredia. Pazopanib, Votrient. Pemetrexed. Pentostatin. Polyamva. Procarbazine. Raltetrexed. Rasburicase. Rose Bengal, PV10. Satraplatin. Streptozicin. Taurolidine. Tegaferuracil. Temozolomide. Temzirolimus, Turicel. Tenofoside. Thiotepa. Chiaguanine. Topotecan. Trabectedin. Triosulfan. Vemurafenib, Zelborov. Vinblastine. Vincristine. Vindazine. Vinorelbine. Compassionate use of drugs for cancer patients. This article is about getting drugs if you're poor. Getting drugs not approved by the system could still be in the testing process. CancerActionNow.org, access a scientifically tested cancer drug before the therapy is FDA approved. cureourchildren.org/compassionateuse.htm, get drugs not FDA approved yet. Abigail-alliance.org, wider access to developmental cancer drugs. cancer.gov/clinical-trials/understanding/approval-for-cancer. Page 4, understanding the approval process for new cancer treatments, special needs. Partnership for Prescription Assistance. pparx.org. Patients who lack prescription coverage. clinicaltrials.gov. What is an expanded access protocol? nlm.nih.gov/services/ctexpaccess.html. essentialdrugs.org, fundamental right of every country to have access to the basic drugs. fda.gov/about fda/centers offices/cder/default.htm, Center for Drug Evaluation and Researches. National Cancer Institute. cancer.gov/cancer topics/facts/therapy/investigational-drug-atches, access to investigational drugs. Pharmaceutical Research and Manufacturers of America, PHRMA. phrma.org/new medicines, new medicines in development. Cancer drug websites. Books about cancer drugs are at #616.994 or RC271 at the library. Meds.com, has drug forums, etc. Drugs.com/clinical_trials. AstraZeneca.ca, cancer drugs. AstraZeneca-us.com, Drug Co., cancer drugs. BMS.com, drug company, cancer research. cancersupportivecare.com/drug_assistance.html. cis/fact, look for effects of many different drugs. cis/fact/7_39.htm, hydrazine sulfate. fda.gov/cder/cancer/access.htm, 800-532-4440, get experimental cancer drugs. fda.gov/cder, 888-463-6332, import a foreign drug not approved in the U.S. fda.gov/oashi/cancer/cancer.html, 888-463-6332, info about clinical trials. pharminfo.com/pub/msb/msbonc.html, cancer drugs. Cancer Liaison Program. FDA. #9-49CFH12. 5600 Fishers Lane. Rock Isle, Maryland 20857. 301-827-4462. fda.gov. Information about new drugs. National Cancer Institute. Public Information Office. Building 31. #10@24. 9000 Rockville Pike. Bethesda, Maryland 20892. 800-4 Cancer. Cancer Fax, 301-402-5874. Cancer Trials. If you'd like to be a part of experimental treatments and drugs, contact them. Oncology Pharmacy Organizations. ASOP.at, Austrian Society of Oncology Pharmacy, ASOP. Founded 2001. Austria. afphb.be/doc/afphb/bok.htm, Belgian Oncology Pharmacy Practitioners, BOP. Hospital Pharmacists from Belgium. Belgium. bpsweb.org/specialties/oncology.cfm, Board of Pharmacy Specialties, Oncology Pharmacy, BPS. BPS is a division of the American Pharmacists Association. Provides certification for Board Certified Oncology Pharmacist, BCOP. USA. bopawebsite.org, British Oncology Pharmacy Association, BOPA. A professional membership association in 1996. UK. capho.org, Canadian Association of Pharmacy in Oncology, CAPHO. Canada. JOP.org, German Society of Oncology Pharmacy, DGOP. Germany. ESOP.eu, European Society of Oncology Pharmacy, ESOP. Europe. HOPARX.org, Hematology/Oncology Pharmacy Association, HOPA. USA. ISOP.org, International Society of Oncology Pharmacy Practitioners, ISOP. PSFO.org, Polish Association of Oncology Pharmacists, PSFO. Poland. SFPO.com, French Society of Oncology Pharmacy, SFPO. France. SAOP.co.za, South African Association of Oncology Pharmacists, SAOP. South Africa. AFOP.ch, Association for Oncology Pharmacy, AFOP. Switzerland. Cancer Drug Journals. anti-cancerdrugs.com. libertonline.com/cbr, Cancer Biotherapy and Radiopharmaceuticals. link.springer.com/journal/280, Cancer Chemotherapy and Pharmacology. opp.sagepub.com, Journal of Oncology Pharmacy Practice. ncbi.nlm.nih.gov/pubmed. Chapter 2. A Chemotherapy Guide. Chemotherapy Info. Chemotherapy helps about 1 of 5 recipients. It helps kill people. Chemotherapy is the use of medicines to help people with cancer. It is one therapy among several. Chemotherapy can be used in a number of ways depending on the type of cancer and its stage of development. It can be used to cure cancer, to keep it from spreading, to slow its growth, to kill cancer cells that may have spread to other parts of the body and to relieve symptoms that may be caused by the cancer. Although doctors could use only a single drug in treatment, generally chemotherapy drugs are more powerful when used in combination with each other. There are currently about 80 types of chemotherapy drugs in use to fight cancer. The advantage of using several chemotherapy drugs at the same time is that each has a different action to eliminate cancer. Some chemotherapy drugs kill cancer cells so tumors may shrink or even disappear. Other drugs work by stopping cancer from spreading. Each anti-cancer drug has a different function. Together, they help maximize a patient's chances. Combination use also reduces the chance that a person will develop a resistance to one particular drug. Oftentimes, chemotherapy is used in conjunction with other treatments like surgery and/or radiation therapy. It could be used to shrink a tumor before surgery or radiation therapy is started, neoadjuvant therapy, or used after surgery or radiation therapy to help destroy any remaining cancer cells, adjuvant therapy. Depending on the type of cancer and the drug or drugs given, a person may receive chemotherapy these ways: orally, by mouth in a pill, capsule, or liquid form. This method may be less expensive since the drugs can be taken at home. Intramuscular injection, by injection into a muscle, under the skin, or directly into a cancerous area in the skin. Transdermal, on the skin. The medication will be applied onto the surface of the skin. Intravenous, into a vein. There are several ways this can be done. A needle inserted into a vein, usually on the forearm. The drug could be given over the space of a few minutes, which is called an intravenous, push, or as an infusion, which can last 30 minutes or a few hours. Intravenous infusions are also given by means of a skin catheter, a thin tube that is placed into a large vein in the body and remains there as long as it is needed. If using a catheter, sometimes a pump is used as well to help regulate the amount of drugs entering the body. There are both internal and external pumps. External pumps are usually small, portable machines, often on wheels for maximum portability. Internal pumps are placed surgically inside the body, usually right under the skin. They contain a small storage area that delivers the drugs into the catheter that goes to the vein or specific target site. Chemotherapy can be expensive. Some health insurance plans will only cover it if done in a hospital, not in a doctor's office. Some plans don't cover drugs not approved by the FDA. If you have problems in this area, call the Association of Community Cancer Centers at accc-cancer.org, 301-984-9496, to see they can help you out. Many cancer patients end up suing their health insurance company and winning. If you have no health insurance, try the Social Security Disability Office, ssa.gov, medicare.gov, medicaid.gov, social assistance from your state health and human service office. Try the big societies and associations and the federal government's National Institute of Health for help too. Make an appeal to the drug companies supplying your drug. Try the Pharmaceutical Research and Manufacturers Association at 800 PMA Info and ask for their directory of prescription drug patient assistance programs. The reactions are diverse. Some people can handle it, others get weak and disoriented. Chemotherapy kills not just cancer cells, but all cells. Modern medicine simply hopes that it will kill the cancer cells before it has killed enough healthy ones to kill the patient. Chemotherapy also kills the cells that form the immune system. Try hashtag 616.994 or RC271 at the library. Types of chemical or chemotherapies. There are different chemicals and different methods to get them into the body and different ways they're targeted, some at the whole body, some at a part of it. Try these terms in search engines. Low-dose cyclophosphamide. Hepatic arterial infusion, HAI. Chemoembolization. Anti-angiogenesis drugs. Molecular and genomic testing. Circulating tumor cells, cell search. Monoclonal antibodies. Immune checkpoint blockade, ICB. Cancer stem cells, CSCS. Veristem and defactinib, VS6063. BBI608, naprobucosine, and BBI503. The LSU super cocktail. Chemotherapy money racket. A German epidemiologist, Dr. Ulrich Abel said. The overall worldwide success rate of chemotherapy is appalling because there is no scientific evidence available anywhere that chemotherapy can extend the lives of patients. Chemotherapy is horrible to live with too after you do it. It's a money racket. Chemotherapy kills a lot of people. It's a stupid gamble, zap your body all to crap in the hopes that you kill the disease. Try quitting all sugar and using hemp. Untreated cancer patients live 4 times longer than treated patients. You got 3 options. Conventional treatment. No treatment. Alternative and self-treatment. In 1975, the British medical journal Lancet reported on a study on chemotherapy where they concluded, no treatment proved a significantly better policy for patients for survival and for quality of remaining life. Before you get chemotherapy, try to get as strong as you can. I was listening to Gary Null, who said he had a cancer convention some time ago. One of the insights was that if you're weak and get chemo, the chemo could kill you. He said do as many healthy things as you can before you get chemo, like detoxify your body. Get rid of mercury fillings. Eat health foods. Drink green and black tea. Eat probiotic foods like yogurt or sauerkraut. He's on prn.fm or YouTube. I listen to him. He's one of the few people who's up on almost everything. He's way smarter than any average brainwashed doctor. Chemotherapy side effects. You feel weak, tired, nauseous. You might need help going to the bathroom. You might have trouble swallowing. Hair usually fall out. People often shave their heads or cut their hair before they get chemo. Buy a wig or hats in advance. Chemotherapy websites. cancerresearchuk.org/cancer-about-cancer/treatment/chemotherapy, chemotherapy. cancerresearchuk.org. macmillan.org.uk/cancer information/cancer treatment/treatment EPES/chemotherapy/chemotherapy.aspx, chemotherapy. macmillan.org.uk. youtube.com, chemotherapy. chemocoach.com. chemeredi.ca. cancer.gov/cancer topics/chemo-side-effects. johnbarron.org/newsletters/05/06062005.php. en.wikipedia.org/wiki/chemotherapy chemotherapies-ide-effects.ca. immunesci.org/chemotherapy no-nxeno.html. cancer.gov/cancer topics/chemotherapy-and-u chemocareheadwear.com. cancer.gov, enter chemotherapy and u. cancer.med.upenn.edu/specialty/med_on/c/chemo. cancersupportivecare.com/pharmacy. chemheritage.org/educational services. meds.com/dchome.html, chemotherapy info. meds.com/mole/chem-u.html. newpogan.com/pub/index1.htm. oncolink.upenn.edu. tiergan.com/chemolsd.htm, list of chemotherapy drugs. yana.org, support for those going through chemotherapy. ChemoCare. 800-55 Chemo. Support Group. Chemotherapy Foundation. 183 Madison Avenue. Number 403. NYC 10016. 212-213-9292. Fax, 212-689-5164. Chapter 3. Biological therapies/targeted therapies/biological response modifiers, BRM. Biological therapies/targeted therapies/biological response modifiers, BRM. Biological therapies use the following things to fight cancer and other diseases called biological materials or biological response modifiers. Genes, cells, tissues, organs, serum vaccines, humoral agents. They may be used to stimulate the immune system to fight cancer, control the cancer cells, kill them or otherwise make the patient feel healthier. macmillan.org.uk/cancer-information/cancer treatment/treatment EP/biological therapies/biological therapies.aspx, biological or targeted therapies. cancerresearchuk.org/cancer-help/about-cancer/treatment/biological, biological therapy. oncolink.org/treatment/article1.cfm?C=231 #ID=333, biologic therapy, the guide. cancer.gov/cancer topics/facts/therapy/biological, biological therapies for cancer. cancerresearch.org, Cancer Research Institute. ncbi.nlm.nih.gov/pubmed ?term=biological therapies, search PubMed database for biological therapies, biological therapies. ncbi.nlm.nih.gov/mesh ?term=biological therapy. isicr.org, International Society for Interferon and Cytokine Research. citcancer.org, Society for Immunotherapy of Cancer. cancer.gov/flash/targeted therapies/flex/main.html number sign app =931b &121b-id M01S01A0, understanding targeted therapies. Angiogenesis inhibitors. Angiogenesis is a process that forms new blood vessels. Tumors need new blood to bring them glucose and other nutrients so that they can thrive, grow, and multiply. If you inhibit the growth of new blood vessels, you can slow the tumor growth process down. Inhibitors work in different ways. By blocking angiogenesis growth, substances, such as VEGF, promote the process of developing blood vessels. Blocking signaling within the cells, tyrosine kinase inhibitors prevent VEGF receptors from sending growth signals into the cell. Acting on the chemical messengers. en.wikipedia.org/wiki/angiogenesis_inhibitor, angiogenesis inhibitor. cancer.gov/cancer topics/facts/het/therapy/angiogenesis-inhibitors, angiogenesis inhibitors. cancerresearch.uk.org/cancer-help/about-cancer/treatment/biological/TEEP/drugs that block cancer blood vessel growth, drugs block cancer blood vessel growth, anti-angiogenics. ncbi.nlm.nih.gov/pubmed ? Angiogenesis inhibitors. listserv.acer.org/script/wa-acor.exe ?a0 angiogen, angiogen. link.springer.com/journal/1043, angiogenesis. angio.org, Angiogenesis Foundation. fdg.unimos.nl/angiognesislab/default.htm, Angiogenesis Laboratory Amsterdam. youtube.com, Angiogenesis and Cancer. Monoclonal antibodies. The immune system has cells that recognize toxic cells and fight them. Monoclonal antibodies are these types of antibody cells made in a laboratory, designed to attach to receptors on cancer cells and kill them. This is a targeted therapy, geared to kill cancer cells only, unlike chemotherapy, which is geared to kill all cells. There are several types of monoclonal antibody treatments like signal the immune system to attack the cancer cells, cause the cell to destroy itself, apoptosis. Block the receptor from binding with protein. cancerresearchuk.org/cancer-help/about-cancer/treatment/biological/TEEP/about monoclonal antibodies, about monoclonal antibodies. cancer.org/treatment/treatments/side effects/treatment EP/IMM-monotherapy/immunotherapy monoclonal antibodies, monoclonal antibodies. macmillan.org.uk/cancer information/cancer treatment/treatment EPES/biological therapies/monoclonal antibodies/monoclonal antibodies.aspx, monoclonal antibodies. cancer.gov/cancer topics/facts/het/therapy/targeted, targeted cancer therapies. ncbi.nlm.nih.gov/pubmed. Interferon alpha websites. Type I interferons are produced by peripheral blood leukocytes and lymphoblastoid cells to protect the body from toxins. They attach to immune system cells, activating them to fight infections and cancer cells. Artificial versions are used for immunotherapy to boost the body's immune system. A subtype, alpha interferons, are used to treat leukemias and lymphomas, skin melanomas, Kaposi sarcoma, etc. cancer.ie/cancer-information/treatments/biological-therapies/interferon, interferon. cancerresearchuk.org/cancer-help/about-cancer/treatment/cancer-dru-gs/interferon, interferon, intran. nlm.nih.gov/medlani+/druginfo/med/a6900006.html, interferon alpha-2a and alpha-2b injection. macmillan.org.uk/cancer information/cancer treatment/treatment EPES/biological therapies/interferon.aspx, interferon alpha. cancer.org/treatment/treatments/side effects/guide to cancer drugs/interferons alpha, interferons, alpha. isicr.org, International Society for Interferon and Cytokine Research. libertpub.com/gr, Journal of Interferon and Cytokine Research. Interleukin-2, Aldesleukin, websites. Interleukin-2, Aldesleukin/interleukin-2, IL-2, is a signaling protein important within immune system function. Cytokine is made by T lymphocytes, a type of white blood cell. It stimulates the immune system. Aldesleukin/interleukin-2 made in the laboratory can be used to boost the immune system. pubchem.ncbi.nlm.nih.gov/summary/summary.cgi sid =$13422247440 LOC =ES_RSS 2D structure of interleukin 2 nlm.nih.gov/medlani+/drug-info/med/a692009.html Aldesleukin evidence.nhs.uk/medicine/aldsleukin Aldesleukin macmillan.org.uk/cancerinformation/cancer treatment/treatment epes/biological therapies/aldesleukin.aspx Aldesleukin cancerresearch.uk.org/cancer-help/about-cancer/treatment/cancer-drew/gs/aldesleukin or IL2 Aldesleukin or IL2 cancer.org/treatment/treatments and side effects/guide to cancer drugs/int or leukin-2 interleukin-2 Aldesleukin ncbi.nlm.nih.gov/pubmed